Hi, Dr. Cannon. Can you tell me what is your background?
So good morning. I came to integrative medicine by kind of a circuitous path. My original training is in anatomic and clinical pathology and blood banking, which basically means I'm a person that likes to get at the root of things, the pathology, the foundation for diseases. That's really my background. I guess when you add that to having a daughter who came here with multiple food allergies, who hadn't really lost any of them as she got older, me really needing to find a reason why she has these food allergies, how we could potentially manage them, what types of diseases that they may lead to at some point, really is what caused me to sort of delve into things a little more deeply than I think I would have if I had just practiced allopathic medicine. I started out in my postgraduate training in obstetrics and gynecology, and then I went to pathology, did a fellowship in transfusion medicine, and had a long career in pathology as faculty member, and did some medical administration, and then really decided I wanted to get back to seeing patients and go back to getting at the root of things. The residency that I did in preventive medicine had some exposure in integrative medicine, and so that was really what sort of, I guess, reignited my interest in something that I had sort of been interested in all along. So that's kind of the background.
Mm-hmm. So, treating patients now at NIA, what is your philosophy?
Well, the thing that it really goes to what I really like about integrative medicine. In this setting, you have a place where you're expected to take time with the patient. You're not expected to see somebody in 10 minutes. So it allows you to talk about what's going on with their body, what's going on in their emotional life, what may be impacting them from the standpoint of their family, their job, stresses, diet. Just allows you to cover the full gamut of things. And then after you examine the patient and then start to discuss the plan, you can really address each of the things that you've addressed in talking to patients at length. So it allows more of an opportunity to be thinking deeply about people's medical problems and what in their lives may have laid the foundation for them to arrive in your office at this point presenting with these particular symptoms. I guess the other thing I would say is one of the things that struck me as a resident working with a lot of patients in the VA hospital is their attachment to long problem lists and long lists of medications, to the point where the patient seemed to really become their problem list. And it was kind of distressing to me to see people labeled that way. And so I really will look at a diagnosis with a patient more as a symptom, because to me it's really a label until you find out what's underlying it. So I'm not going to look at your diagnosis as the thing to be attended to. I'm going to look at what potentially might have caused these symptoms and try to address myself to that. And the ability to do that is really what attracted me to integrative medicine.
So, you'll be focusing on primary care and what other areas?
Primary care, women's health, particularly in the perimenopausal, postmenopausal period, and I really want to focus on detoxification issues, for lack of a better word. I think that's what most integrative medicine practitioners will call it, but from a patient standpoint, it's more so symptoms manifest as some very serious, perhaps neurological, infectious disease entities, autoimmune disorders that may have their basis in your exposure in the past to some toxins accumulating over a period of time without anybody addressing them. That's going to really be my focus.